Students often get stuck between IBD and IBS because they sound so similar, but there is a simple analogy which will help you to remember. Consider IBD as the road damaged, which is full of potholes, while IBS is a traffic jam, irritating, but the road itself is fine. So now let's break this step by step using same analogy throughout. Remember, in IBD, which is inflammatory bowel disease, there is a chronic autoimmune disease where the immune system attacks the intestine, causing real inflammation, ulcers, and damage and permanent damage. Focus that there is a tissue distraction. As I have already mentioned you, that it is the road which is broken and is with the patrols, mean vehicles, or that is food, is struggles and road needs repair. In IBS, there that is irritable bowel syndrome is a functional problem. The gut moves abnormally, but there is no damage seen. Focus on the thing that there is no structural damage, there is only functional abnormality, like traffic jam on the smooth road. Smooth road means there is no structural damage, which is frustrating, and you face difficulty in moving your vehicles or your cars or motorcycles or through the traffic. So there is a problem in the mortality, so it is a mortality disorder. As you face difficulty in moving, so your mortality decreases, that is constipation is often seen in this. But if somewhere you get space, you will speed up your vehicle and try to run up, so diarrhea can also occur. So in IBS, both diarrhea and constipation occur alternatingly, while in IBD there is a persistent diarrhea only. So now let's focus in detail about the difference between both of these. First of all, the pathophysiology. IBD is an autoimmune inflammation causing the damage, while IBS is functional mortality disorder which do not cause any structural damage. Causes, as already you knew, that stress is the main factor in IBS, that is stress, anxiety, altered gut, brain signaling, food triggers will contribute to the IBS, while in IBD, autoimmune, genetic, environmental factors will contribute. This you can remember that in traffic, stress induces in you bile thing which is already broken road, that is your body already broken, that is your own body, that is autoimmune, is IBD. And IBD is mostly in the teens, young adults, and at 60s it pick up, and IBS is in young adults and in women. Both occur early, but IBS is more in women. Damage. Yes, there is a damage in the IBD. There are ulcers, strictures, and bleeding, like the road which is dug like pits that are similar to ulcers, strictures, fistulas, bleeding, while in IBS there is no structural change as it is, so colonoscopy and biopsy appears normal. In symptoms, there is a persistent bloody diarrhea, fever, weight loss, malnutrition. In IBS, there is pain which is relieved after the stool, bloating, constipation, diarrhea, or This you can remember that IBS pain improves after the bowel movement. Mean after the traffic is resolved, it will disappear. Mean pain will disappear. But in IBD, pain will persist. In extra symptoms, there are joints, eyes, skin affected in IBD. These are affected as autoimmune system is affected. Your own body is attacking your own body cells and organs. So arthritis, eye issues, skin lesions are present. While in IBS, there is no attack on your own body, so no symptoms appear such. In complications, cancer, toxic megacolon perforation occur in IBD, while no such symptom is present in IBS. And on labs, there are abnormal lab examinations present in IBD like increased WBC, CRP, anemia, ulcers are visible, while in IBS everything is normal, and it is the diagnosis of exclusion. Diagnosis of exclusion means you will first of all diagnose that all other conditions related to the symptoms. Then, at last, if no underlying diagnostic test confirm that conditions or diseases or disorders, then after that you will conclude that it is IBS, as there is no any confirmatory test available for the IBS. And for the treatment, anti-inflammatory steroids, immunosuppressants, biologics, and surgery is available for the IBD, while IBS is induced by your triggers or stress factors, so it needs your lifestyle modifications like diet, stress control, fiber, antispasmodics. In prognosis, there is lifelong, progressive, and may need surgery in IBD, while in IBS it is chronic but benign. There is no structural damage involved. So next, as what is the are there some red flags which appear in the NCLEX exams? IBD is weight loss, bloody stool, fever, abnormal labs. In IBS, normal labs, no blood, no weight loss. In diagnosis, IBD colonoscopy will show the ulcers, while in IBS, as the road is smooth, so everything will appear normal. In complications, your road is so broken, so everything is broken. Perforations, holes, that is, toxic megacolon, cancer risk is involved in IBD, while in IBS there is no structural complication. In management, medications to control inflammation you will use, and you will go for the surgery. Like similarly, your road will need reconstruction. In IBS, as no problem in the road, everything is smooth, you need to solve the traffic. So that is, you need to make the lifestyle changes, stress management, dietary control. In dietary control, you have to take low food map diet. Food map diet means that diet which do not induce the gas formation or fermentation is involved, like dairy products. One more thing you have to remember is in IBS, you have to maintain your diary so that you could find your triggers, as triggers are different in each and every individual. One more thing you have to think is NCLEX asks if the patient with diarrhea plus abdominal damage is coming to you, you have to ask weight loss or blood, fever, abnormal labs are present or not. If these are present, then it means IBD, that is damaged road. If no, then it is IBS traffic jam. D for damage and S for stress. Okay, so always remember that IBD is damaged road, IBS is traffic jam, one destroys the gut and other just irritates it. So with this analogy, you will never confuse them again on NCLEX. Don't forget to like, share and subscribe for more high yielding NCLEX content.